Since 1990, we have spent millions of euros and tens of thousands of research hours to find scientific answers to life's most important and challenging questions. What makes us happy? What makes us healthy? How can we heal from physical and mental disease? How can we heal emotionally and sexually so we can be happy in our relationships? How can we develop our talents and be of value to the world? We have interviewed more than 15,000 people and asked more than 4,000 different questions. After 20 years of intensive research, we are beginning to find the answers we have been looking for so long. We have already presented these answers in 250 research papers and about 30 books. Now we bring it over to you. Welcome back to the Quality of Life Research Center, Copenhagen. Today I will tell you about a paper we wrote called Clinical Holistic Medicine, Holistic Treatment of Children. Clinical Holistic Medicine is the Hippocratic medicine where we are basically using talk therapy and touch therapy and nothing else. And when it comes to children, it is important to understand what causes suffering and illness and bad thriving in children. In this paper we suggest that the reason is that the children have some needs which are not fulfilled, and we identify 5 needs all kids have and say that if these needs are fulfilled, then the kids will normally be thriving, happy and healthy. So what is it that a child needs to be healthy? We found first attention. All children need attention, and they need attention in a good quality from their parents and other people around them. And very often, in a busy life, children are not getting attention enough. So, what is important here is to address this together with the parents. How is the family situation? How is the family working? How much attention are the children actually getting, and in which quality is attention? With quality of attention, I mean, do you play together? Are you really interacting on a deep psychological and emotional level, or is it just basic needs fulfillment, like I'm hungry, okay, you're not hungry, okay, then take care of yourself, goodbye, like this. The next thing is respect. Respect is a difficult quality, because respect means that you're meeting the child at its borders. You can only do that if you are keeping your own borders. You cannot really put borders up for a child. You need to put borders up for yourself and allow the child to meet you as a parent. And few parents are actually familiar with their own borders so well that they really can meet the child at the border. So if a child is sick or not thriving, it's very often about the parents' lack of understanding of their own psychological and emotional and physical borders. So a very important thing to help children thriving is to teach parents about borders, so that they're able to keep their own borders and give the child respect in the meeting. The next thing we found that children need, which are highly problematical, is love. Kids need love. So, what is love? Basically, love is that you are one. So parents need to see themselves in the child. They need to understand that they are one with the child, psychologically, or not really psychologically, but spiritually, like in the core, in the essence. And this is very difficult for many parents to understand what love is, and to really like come from the heart or from the core of existence and meet the children in a loving way. The opposite of love is power, force. So many parents compensate for the lack of love with force. It's not that the parents are not really loving their kids, because I think all parents love their kid, but in the play, they don't. Parents often do not give themselves time to anchor themselves in truth, in love, in existence, in the heart, and meet their children from that position. So it becomes busy and mental and forceful, and this is harmful for kids when instead of love they're treated with force. It becomes a subtle violence often, the quality of punishment and reward. It becomes a play, a game, instead of just being together in a peaceful, harmonic way. So, as a doctor or therapist, you can work with a family and you can teach parents what love is. Of course, you cannot teach them what love is. They need to find it themselves and understand and realize it. But you can point to it, and they can watch it in the daily living with the children. And this is a very powerful tool for rebalancing the family and bring the sick children back to health. The next thing children need, which is also difficult, is touch. Touch, hugs, physical holding brings acceptance. When you're hugging a child, when you are really loving a child, caressing it, petting it, it feels accepted on a deep physiological level. And this acceptance is totally necessary for a healthy psychosocial development. So it's very important that the parents are having physical, intimate contact with the children, and again, combined with respect, of course. So the borders, the physical borders, are kept during that interaction. So it doesn't become abusive, and it doesn't become like too cold, emotionally cold, too withdrawn, too like having the quality of neglect and fail. So acceptance, touch is very important. This is difficult with parents because many parents are not able to even touch each other in that way. So very often physical therapy that helps the parents back to a basic ability to touch each other is also making way for a natural way to touch the children. The fifth dimension we found that children need is acknowledgement. All children, all human beings carry a depth in their soul, and in this depth they have a core personality, or you could call it a talent, something they bring to the world, a gift to the world. And it's extremely important for everybody, but more for children than for adults, that this gift, this depth, is seen and acknowledged and loved. And this seems to be the most difficult for parents, because if parents are not knowing themselves well, then it's almost impossible to ascribe good qualities, wonderful talents, this depth to the child. So this need can only be fulfilled by parents who are conscious about who they are themselves. And it's quite a job to teach parents this part. So often this is like the last we do in the clinic when we're having a difficult child, a sick child. That is to teach parents about who they truly are. But in many cases this is actually necessary. Very often the child remains sick, remains in a bad condition until this is up to the parents. So it's like the child is a thermometer of the family. It tells the temperature of the whole family situation. So on the child health you can see if the family is healthy or not. And to know yourself is the true key to health and happiness in the child and in the parents.